Blastomycosis is a rare infection caused by a fungus called Blastomyces. This fungus most often infects the lungs, and the infection is also known as North American blastomycosis, or Gilchrist disease. The fungus that causes blastomycosis is commonly found outdoors in dirt, leaves, and wood, and it is a mold that creates spores. Blastomyces is commonly found in the Midwestern, South-Central, and Southeastern U.S., particularly in Wisconsin, and it also exists in Canada. There have been reports of Blastomyces in India and Africa as well. Experts believe that climate change is causing fungi like Blastomyces to spread outside of their usual areas, which could lead to an increase in infections. When someone inhales Blastomyces spores, about half of them will experience symptoms. These symptoms can appear as early as 3 days after exposure or as late as 3 months afterwards. Some cases can even improve without treatment. Symptoms of blastomycosis can include coughing, or coughing up blood, fever, shortness of breath, chest or back pain, muscle aches or joint pain, night sweats, loss of appetite or weight loss, feeling tired, and skin sores. As the infection spreads, you may notice painless sores on your body that can resemble ulcers or warts. These sores may be gray or violet in color, and can occur in your mouth or nose, and may even bleed. Blastomycosis is not contagious and cannot be transmitted from person to person. It also cannot be contracted from animals, except in very rare cases where a human has been bitten by an animal who is infected with the fungus. The duration of symptoms can vary greatly depending on your overall health. Most people will need to take antifungal medications for a minimum of 6 months. If you're working in the garden or doing any activities involving digging in the dirt, you could potentially be exposed to Blastomyces spores. Once inhaled, these spores can lead to an infection in your lungs. Alternatively, the fungus can also infect an open skin wound and affect only that specific area of your body. It's important to note that animals can also get blastomycosis in the same way humans do, by breathing in the spores or exposing an open wound to them. However, cats are less likely to get it than dogs. Blastomycosis can affect anyone who is in an area where the fungus grows. You may be at higher risk if you work outside, spend time in the dirt, work in a lab, or have been bitten by an infected dog or stuck with a needle that's been in an infected dog. However, this type of infection is very rare and usually only affects the skin, not the lungs. If you have a weakened immune system, you are at risk for a more severe infection. This can be caused by taking medication that affects your immune system, receiving an organ donation, or having HIV, AIDS. If you think you've been around the fungus or an infected animal, it's important to see your doctor. They will ask about your possible exposure and conduct a physical exam. Your doctor may order one or more of the following tests to check for blastomycosis. Chest X-ray. Chest CT scan. Skin or tissue biopsy or culture. Culture of your sputum, chest congestion. Urine test. Blood test. It may take some time to get the test results. Early detection is crucial, as blastomycosis symptoms can be mistaken for bacterial pneumonia. This could lead to a misdiagnosis and delay in receiving the appropriate treatment. Some experts believe that doctors may not be familiar with fungal lung infections like blastomycosis, especially in areas where it hasn't been common in the past. It's common for healthcare providers to misdiagnose fungal infections as bacterial infections, leading to unnecessary antibiotic treatment. This can contribute to antimicrobial resistance, making it harder to treat bacterial infections in the future. So, how do you treat blastomycosis? Well, if your immune system is working properly, your doctor will likely prescribe an antifungal medication such as itraconazole. You may need to take this medication for 6 months to a year. However, if the infection has spread to other parts of your body and is more severe, your healthcare provider may recommend a medication called amphotericin B for a few weeks, followed by itraconazole for 6 months to a year or even longer. In some cases, if the infection is very mild and only in your lungs, and you are already starting to feel better, you may not need any treatment at all. But most of the time, treatment is necessary to help you recover from blastomycosis. In severe cases of blastomycosis, you may experience scarring from the skin sores, a relapse of the infection, and side effects from the medications used to treat it. If your immune system is healthy, your chances of recovery from blastomycosis are good. However, if left untreated, blastomycosis can be fatal. In the period from 1987 to 2018, there were 4,441 reported cases of blastomycosis in 5 states, with 8% of those infected unfortunately passing away. Research has shown that there are health disparities in the occurrence and presentation of blastomycosis. Most of the research on this fungal infection has been focused on white people, but there is evidence that there are clinical differences based on race. For example, black individuals have a higher rate of infection, a higher likelihood of the infection spreading throughout the body, and a higher chance of death. Additionally, there are also higher rates of blastomycosis in Canada's Indigenous people, American Indians, and Asian people compared to white people. Blastomycosis cannot be prevented, as it is difficult to avoid exposure to soil that may contain the fungus. Even if you try to avoid soil in certain areas, you can still get blastomycosis if the spores are in the air. Additionally, there is no reliable way to test your soil to see if the fungus is present.